Hello and welcome to Slipstream's podcasts. You can also view this on our YouTube channel, Slipstream Campus. That's all one word, Slipstream Campus.
Today we're going to talk about medications in the wilderness and reducing the risks both to yourself and to your patients. My name is Michael Doc Crawford. Medications in the wilderness can be a highly controversial topic. There's risks when giving medications, but there's also risk if you're going to withhold medications. Certain medications are controlled, meaning they need to be given by prescription only. And then other medications are what we would call over-the-counter medications. Now, when we're in the wilderness, we have limited backup systems such as 911 and hospitals. And as a result, whether you're a trip leader or just an individual going into the wilderness, you have to figure this risk management equation regarding medications out so that you're avoiding health risks to a patient or legal risks to yourself from using medications that you're not familiar with. Proper preparation can help mitigate this risk. Now, it's important to emphasize there is no zero risk that you're going to be able to achieve, but you want to be able to sleep at night over decisions that you do make regarding medications. These 7 R's, or 7 rights of medication, is a time and tested and true method that you can use to help mitigate risk for both your patient and for yourself. The 7 R's are the right patient, the right time, the right medication, the right dose, the right route, the right expiry date, and the right documentation and authorization. So where the right patient applies in the wilderness, let's imagine you go into where your medication is stored and you have 6 different pill bottles, all with white pills in them. How do we know that we have the right medication and the right patient in that situation? And that should be on the label of that bottle is what it should be, and then you know who you have. At the end of this discussion, we'll talk about proper packaging for wilderness trips of medications. The second right is the right time. And many medications are given on a time kind of a basis, whether it's every 4 or 6 hours or 4 times a day or before meals or after meals, at the onset of some condition like maybe an allergy or something like that. And that's where you need to make sure you have the right time for a medication. The right medication applies to you need to make sure you have the right medication for that person, so it kind of crosses over with the right patient as well, but you also need to make sure you have the appropriate medication for that condition. And this is where your wilderness first aid training and evaluating patients comes in as well. The right dosage means that you need to make sure you have the correct dosage for that patient for that particular condition. And doctors will usually have made adjustments, doctors or pharmacists will usually have made adjustments to that dosage to get the patient to a certain level of where they want them to be. The next right is the right route. And with the right route, what we're concerned with here is how the medication gets into the human body. There's lots of different ways here. You can take medications orally or under the tongue, sublingually, suppositories. It could be topical, you rubbed on the skin, or it could be inhaled like an asthma inhaler. Some medications are injected, and then there's different injection methods like subcutaneous and intradermal and intramuscular and tons of different ways to get medications in the body. But you got to make sure you're utilizing the correct route. Not all medications are absorbed the same way through different routes of administration. Sure that the right route is followed regarding a medication is that a lot of medications are not absorbed the same way through different routes of administration. A medication that you might take underneath your tongue, you can't just stick that medication in someone's rear end and expect it to have the same absorption at the same rate. And so the right route is really important to follow. The next right is the right of expiry date. And this, of any of the things that we're talking about, is one of the easiest ones to solve because the manufacturer puts a date on a bottle of medication with the expiry on it. And all you have to do is check this out. Because pharmaceutical companies cannot guarantee how effective, if at all, a medication will be beyond that expiry date. And that's the next right that we're going to talk about is the right documentation or authorization. And this we're going to split into 2 small categories. One being we want to make sure that we mitigate risks to the patient by not giving a patient a medication that may cause them harm or something like that. And the other thing that we want to make sure that we're doing is mitigating risks to ourselves. If you're the person who makes a decision to give a medication to a patient, you want to make sure that you have the correct authorization such that if there is a problem, it doesn't come back on you. Remember, you don't have a medical license.
Right.
And the next right that we're going to talk about is the right documentation and authorization. And this I'm going to split into two categories, and this is going to be based on risk. One, we want to mitigate the risk to the patient of giving that medication. And so we want to make sure we're doing that properly, and we have all our ducks in a row. And the next thing that we want to do is mitigate the risk to ourselves of making the decision to use a medication in a certain situation. Those of you that have medical licenses, you know what I'm talking about. Those of you that don't have a medical license, well, we want to make sure that we're not going to get ourselves in hot water using some medications. So along with the right documentation, some of the things that we want to address here is making sure that we have the right CPS or PDR documentation on a medication so that we're able to read up on this medication and we know how it's going to affect the patient. We also need to make sure we have a good patient history on our patient so that we're making sure that the medication that we're giving is appropriate for that situation. We also need to make sure the medication is being stored properly and handled properly throughout the whole trip so that we know it's going to work when it's needed. So now we're going to talk about the right authorization. And we're going to span the range of medications from the Dimatab that you could get at your local corner store all the way up through maybe propofol, which is an anesthetic agent and only available through the hospitals. So let's talk a minute about corner store type medications, stuff that you can just buy almost anywhere. Well, these medications you can't be complacent about. You still need to follow these 7 R's, this process for administering these medications to patients. If your patient, for example, had an allergy and you gave them this medication, then bad things could result. And in a wilderness setting, you're a long way from definitive care. So the 7 R's, even for corner store type medications, are still the right patient, the right time, the right dose, the right medication, the right route, the right expiry, and the right documentation and authorization. Now those corner store medications don't require any special authorization of any sort in order to administer those. However, now we're going to discuss medications that do require a certain authorization in order to be used. So now, with medications that require authorization to use, you can end up, without authorization, you can end up getting yourself in some really legal hot water. Things such as practicing medicine without a license, trafficking and narcotics and things like that. And so you want to be really careful here. And you want to make sure that you have the right authorization to use these medications in a wilderness setting. The first way to get proper authorization is to go to school long enough that you get said medical license. The second way is to get a pre-authorization from a medical doctor to hand out these drugs. Some people know this as a pre-packaged protocol. Basically, I liken it to, in case of fire, break glass. So if something bad comes up, it meets the criteria for that medication according to what the physician has advised you, and you can open up this bag and use that medication. Now let's pretend that we're on a wilderness trip. And one of these people on this trip, they start having signs and symptoms that look somewhat like a heart attack to you. Now the benefits of giving aspirin in the early hours of a heart attack can be fantastic. The science behind it is solid. But what you need to think about here is aspirin given for a headache is a corner store medication. Aspirin given in the case of a heart attack is now a medication that requires authorization. You can cause harm to people with aspirin, a drug as simple as aspirin. And that's where the 7 R's come into play. The 7 R's will help you mitigate the risk to the patient, and the right authorization will help you mitigate the risk to yourself.